I'm Megha Shrivastava. I am a preventive medicine resident at Mount Sinai in my second year and doing addiction fellowship next year. I'm going to be talking a bit about substance use. I'm actually here at Mount Sinai right now as well with some of our other residents and two of my bosses. And one of them actually works at the REACH program, which I'll talk about a little bit at the end. But it's a really great program for if you or anyone you know uses substances and needs a primary care doctor. It's a really great clinic. We're going to talk about substance use in our community, and this is a pretty sensitive topic and sometimes hard to talk about. We're going to talk a little bit about what substance use is, what addiction is, why do we care about it, and what can we do about it. So substance use is something that impacts the person that's using a substance, and then also their family and community. And then in a lot of larger ways, this can really impact larger communities and some of the interactions in society and in like the carceral system. So just to think about that as a framework, often we do associate it with something that like alters what we say is like executive functioning. And so like altering our moods and getting you high. That is often what we think about. I think also we kind of want to reframe that a little bit because substances in general too, and this is kind of a picture here of a coffee plant. That's something that still alters like something in our body. So it has some sort of physiologic change in our body and alters kind of the energy that we feel in our brain. A lot of people use it for like self-medicating for pain, also for like mental health reasons of like anxiety and depression and using it for those. And then there's also like the use for personal enjoyment or euphoria. There's also a lot of medical purposes and people that use like medical marijuana, for example, that are used as medical reasons for medicating like their pain. And then some other ones that we don't always think about is that there are some religious ceremonial uses for certain substances as well. And that a lot of people kind of get to the point of actually using their substances more to treat withdrawal or to prevent the pain that can happen from not having that drug in your system. And then some people use it as survival, especially for a lot of people that are experiencing homelessness, using some stimulants as a way to make sure their area is not harmed or that things aren't stolen from them is kind of what some people do as means of surviving as well. So there's many different reasons that people do use substances. Some of the different ways that people use substances, this is a graphic that shows the different levels to which people may use substances or engage with them. So all the way from complete abstinence or not using any substances to beneficial use, perhaps for like religious use or engaging with it in a way that's like social or has some sort of like positive impact or not really too much harm. And then having lower risk use. So using in a way that has minimal impact, but may not be necessarily beneficial, but doesn't actually cause too much risk in your personal life. And there's higher risk use where it can start having a little bit more of an impact or feeling like it has harmful consequences in someone's personal life to like an actual, what we kind of call an addiction or a substance use disorder. That is where your body and your brain are more dependent and more at a place that really needs that substance, and that it also is causing harmful consequences alongside with that dependence and need of your body. So a big part of how we define addiction, it's a chronic relapsing disorder characterized by compulsive drug seeking, continued use despite harmful consequences, and long-lasting changes in the brain. The big parts of this is that it's really considered this disorder or an addiction when there's associated harmful consequences that are seen with that individual or in that individual's life. This is a big reminder too that substance use and addiction is really a chronic illness. This is compared to some of the other relapsing of hypertension and asthma for people. It's actually even less common to relapse in terms of substance use compared to hypertension and asthma. So this is just a reminder that this is really a chronic illness and it causes long-lasting changes in the brain. One of the big things to remember about this is that because a lot of substances really cause these bursts of dopamine in the brain, it really affects and rewires how the brain works in terms of the reward system. So this can make a lot of people seek substances as a treatment for this not having that same reward system. And there's ways to get out of that too. Some things you might notice for people that use certain substances. This is part of this larger guide for families that can help recognize recognize and see like which substances someone might be taking part in. The main things are really just changes in how someone is acting. For certain things, like for alcohol, you may see more lack of coordination and nausea and vomiting. And then for certain other substances, you may see more of like a slowed, like drowsiness and nervousness or slurred speech. There's many different classes of substances. There's many different ways that substances can really impact our bodies, different symptoms that people can have. And not all substances are the same in terms of how they interact and how they cause dependence or addiction. Fentanyl that exists in the drug supply now is becoming more and more of an issue where it's been contaminated in not just opioids like we've previously seen, but in a lot of stimulants as well, and benzodiazepines and other substances that are found on the street. This is a very risky substance. We'll talk more about fentanyl too and just what we can do about it, which is going to be fentanyl testing, and something that you want to do specifically because fentanyl is really seen commonly in all opioids at this point and heroin that's on the street. It's really something you'd want to test more for cocaine and for benzodiazepines and other pressed pills on the street. But in terms of just opioid use and what it's looked like over time, there's really been this increase in opioid use since the 90s. And the first was really related to some of the prescription opioids that were being prescribed by a lot of physicians in the 90s. And then there was this change of physicians recognizing that and trying to go the opposite way of being like, we can't prescribe at all and we're not going to be doing this anymore, and having a lot more regulation of prescribing opioids, even for a lot of patients that may have needed it for pain. That kind of pushed many people to seek those opioids in other ways since they weren't getting it through medicine. So that kind of caused a big rise in more heroin use and street opioid use. That started more, and then in like 2013 and onwards, there's been more of a rise in like fentanyl implementation in the drug supply. That is a very potent type of opioid that puts people at even higher risk, a way higher risk of overdose. And so that is really what we're seeing now, of there being such a large increase of a lot of overdoses and overdose deaths that's hugely related to fentanyl in the drug supply. In terms of just thinking about people that use substances, there's actually more white individuals that use substances than Black individuals. But what we actually see is that there are more Black people that are incarcerated from drug use than white individuals. So Black people are 6.5 times more likely than white people to be incarcerated for drug use. This is really just a reminder that there's a lot of inequity and discrepancies in what we're seeing of who really gets punished for using substances. It's really something that interacts hugely with our family and ourself and community. There are actually medications that are available for certain substance use disorders, for alcohol use disorder, for opioid use disorder, tobacco use disorder. There are some really good medications that can really help people alongside some of the therapy and other supports that people should have. And then for stimulant use disorder and cannabis use disorder, there's not exactly like quite as evidence-based as we say treatments compared to opioid use disorder and alcohol use disorder, but there's still some medications that are available and possible that can be talked about more thoroughly with your physician. But hugely for all of these, and even alongside with medication, behavioral therapy is so important. And just a reminder for substance use, and then also outside of it, that therapy, it's not one size fits all. There's not one type of therapy. There's many different types of therapies. And there's a lot of specialists that are really catered for substance use specifically that can really help. There's many different treatment options in terms of substance use disorder overall in our country. In terms of people that are 12 and older, there's actually 7.4% of people overall have a substance use disorder. This is data from 2019. Of those 7.4% of total people in America that have a substance use disorder, the most common is actually alcohol use disorder, and then also illicit drug use disorder, which includes heroin use disorder and cocaine use disorder and methamphetamine, all in that category, and then marijuana use disorder. For New York City, in terms of adolescents that use substances, there's been an actual decrease in alcohol use for New York year, but there's been an increase of opioid use amongst younger people. So tobacco, when we were talking about how we define a drug and addiction, it's still considered a drug. It's considered a substance. Us thinking about drugs as giving us a high, that's really not the official definition of what a drug is, of whether it can give us a high or not, but that's often what we associate with drugs that feel very debilitating. So tobacco use, it can be as addictive as heroin, cocaine, or alcohol, but it's often not quite as debilitating and harmful consequences day to day in the same way, which actually can often make it harder for people to quit in many ways. It is number one cause of death and preventable death and disease in America, and it can cause 480,000 deaths each year in our country. It's probably the most commonly used drug, but is often overlooked in its harms. We're kind of focusing on some of the substances that feel like they cause a lot more harmful consequences day to day in terms of behavior, but this is a very important one to remember, can be very deadly and harmful as well. It can cause heart disease, lung cancer, COPD, as well as other cancers and stroke. Tobacco users, they die 10 years earlier than people who don't smoke. And there's also a big association with tobacco use as well with mental illness, just like we see with some of the other drugs as well. So in terms of health risks of substance use, we talked a little bit about addiction and some of like the social consequences, impacts with relationships, the interaction with mental health. Those are really huge risks. And then there's also some other physiological risks in our bodies that can be impacted by substances. This can include cancer, and often even for like alcohol use, people don't always remember that that can increase your risk for cancer, as well as diabetes and cardiovascular disease as well. And liver damage is a huge one that we often know is associated with alcohol. Dental impacts, that's often with some stimulants, can cause that. And then brain damage, sometimes there can be cognitive changes with ongoing use of certain stimulants. And then infection is a huge one that we think about with people that inject drugs. So HIV, hepatitis C, hepatitis B, endocarditis is an infection in the heart that can be very serious. I think we all know that there are health risks associated with substance use. This really depends on which substance, and it varies in terms of what the risk is, and then really how the substance is used, whether it's ingested or injected, and then how much of it is used and how frequently. If someone drinks alcohol like once a month, that's going to be a lot less of a risk of any of these than someone who is drinking every day and drinking a large amount every day. In terms of just talking about health risks, I think it's helpful to know some of these risks about it. Often what I've seen with some family and community is feeling like, why are you doing this to yourself? Because this is causing so much risk for your health. It's still very important to reshape that. While it's important and good that we know that there are risks to it, it's important to realize that in terms of engaging with substances, this is someone's individual choice. And even while we encourage people to try to make better choices for themselves, that needs to be done in a very careful way and in a very understanding way. A lot of times for people, there's a lot of things that have led people to engage and depend on substances that is sometimes very much out of their control. And many of them do know the health risks that are related to it, and they still choose to do it because their body and their minds depend on it a lot. Just thinking about how we talk about substance use, and this is very important because the more that we make people feel othered or feel kind of like they're making this large mistake or feeling like a shame around what they're doing, the less that they'll feel open about talking about it, about working towards it, and kind of achieving goals towards it. So this is really impactful from how we all as society look at people that use substances. A lot of in our medical world and in general, we're trying to move away from certain language that can feel a little shameful towards individuals. So instead of using words like addict, alcoholic, junkie, we want to try to use words that are a little more appropriate. So saying someone with a substance use disorder, because this is also reminding us that this is an actual disease. It's not a characteristic, and it's also not a personal trait of people's. It's important to use similar language that we would if someone had diabetes or hypertension. So saying someone with alcohol use disorder instead of alcoholic. And same with reformed addict or former addict, saying something like a person who previously used. Stigma, the word itself, means the perception that a certain attribute makes a person unacceptably different from others, and this can lead to prejudice and discrimination against them. The key word is unacceptably different. I think that stigma has this this feeling that this person, these certain things about them is kind of unacceptable. This is like a negative perception of how someone is. And this can lead to prejudice and discrimination. And this sense from people who do use substances can really hinder them from really wanting to seek help or feeling open or feeling like they can talk about what's happening. So we really want to work towards putting less shame on people as much as possible. What our goal is today is to think about addiction and then providing an environment and destigmatizing that can have such a huge impact in society and how we are able to encourage people to make that individual choice, even indirectly. This is also from the same family guide for people that want more information about how to cope with either a family member or friend that may be affected by addiction. But this is showing the illness affecting the person who's addicted and then affecting the surrounding family as well. And then the illness progressing is often very much associated with some of that shame, that stigma, that secret that kind of lets the illness progress and lets the use of substances or gambling as well into something that is not really appropriate. And then these are some roles that they talk about in the family, the survival roles in terms of a family member coping with someone who has addiction. It's very complicated and there's not always the perfect way to approach someone, but these are some ways that people can often cope. One is like the enabler, someone who's very well intentioned, but who kind of like takes on the responsibilities to try to get this person the care that they need. That's incredibly hard if that person does not want that care, and you can't really force that on someone either. And then there's the mascot who copes with things by distracting with humor. And then there's the one they are calling the lost, who's checked out and doesn't really involve themselves. And the scapegoat is another category that they talk about of someone who acts themselves dysfunctional, also kind of as a distraction. In terms of just recognizing someone who may be having a substance use, even before it gets very escalated, is just noticing changes in their mood, changes in how they socialize, changes in personal hygiene, noticing differences in how people are keeping up their room, their environment. Some blatant signs are seeing some tools around them that people may use for ingesting or using substances. And also some changes like seeing a lot of nausea, vomiting, shaking. Those are all things that can alert you that someone may be affected by a substance use problem. As support members of how to address or to think about things, I think the most important thing is really trying to be there for people in however way you can sense that they would need that support, because we know that it was really an individual choice and their journey with their substance on how they can seek help, whether they want to seek help, being a person that is a safe space but not necessarily pushing them too much, I think is important. As family members, you don't have a professional obligation to be able to really help people. And there's a lot of limits to what you can do for people, but being able to try to provide resources to them if they're open to it is important. And if they're not open to it, to be able to step back from that and to not push things too much. Some things that people can recommend often to family is talking to them about the dangers of substance use and explaining to them what substance use is. Obviously, this depends on the family member and whether you feel like they do know these things or not, but often a lot of people who use substances are very aware of the risks and the dangers of it. What almost better to do is kind of encouraging them to seek medical help, not even necessarily for their substance use, but for other things in their lives as well. It's really important to have a primary care doctor and to have someone that you can trust and to be able to talk to. And often family members may not always be the person that people who are suffering from a substance use disorder feel comfortable talking with. So getting them into at least accessing healthcare in some way can be really beneficial. And it doesn't always have to be just related to their substance use or even related at all. Just encouraging them to speak with professionals one way or the other can be really good. Also, educating yourself and finding support for yourself too. If you're experiencing a loved one who is suffering from a substance use disorder and it's weighing on you in any way, it's really important to take care of yourself and realize that the relationships that we have can be really impactful to us, and someone that you see that you really want better for, it can be very hard to want that for someone and to feel limited in how you can really control that situation. Part of it is really accepting that there's a lot you can't control in that situation, but what you can control is finding your own peace and finding support for yourself. And then if you're able to, obviously providing some resources for your loved ones too. So in terms of just harm reduction, some of the bigger things to remember is that even if we feel like society might be better if we just didn't have any substances, the reality is that they exist in our world, and people will continue to choose to use substances or not to use substances. And our biggest responsibility and our biggest role is to really encourage people to use as safely as possible, and then provide them resources to get to what their goals are with their engagement with substances. So really working towards not being judgmental, not being coercive, and accepting people where they are in terms of their substance use and where they want to be. And when it is at a place that feels really harmful or really negatively impacting the people around them, trying to find ways to mitigate that harm, improve ways that they're using to decrease their own health risks. One of the example of that is using clean syringes for people that inject drugs, and having hotlines for people that are using alone so that they don't overdose alone. And in doing that, reminding them that is not associated with law enforcement as well, that there are ways to engage in a more harm reduced way. So one of the big harm reduction things is Narcan. We want every person in New York to have Narcan on hand with them, especially as we're seeing so much more drug use and overdose related deaths in the community. This is Narcan. This part is the nozzle that goes in your nose, and this part is the plunger. So really, when you see someone that is not breathing or passed out, you check for overdose. So checking for overdose is seeing that if someone's not breathing well and they're not waking up when you try to wake them up, but they still have a pulse. So you want to, at that point, call 911 and tell them someone's not breathing, think it's an overdose, and to mention that you just need medical only, and then ideally staying until someone can come help. And then the way that you use Narcan is using this nozzle into one of the nostrils, and it's about like a little under an inch into the nostril. And then you push the plunger all the way up, and then you wait sometimes 2 minutes, 3 minutes, and then you would give another dose. So typically the Narcan packages come with 2 Narcans, and you would take the second one and you would put that in the other nostril and then do the same thing and push all the way up. And then you do want to make sure that help is coming on the way. So you do want to call before you give the Narcan. If they're not breathing after another 3 minutes of giving the second dose, then you want to give breaths or CPR. And at the very least, we do want you to be able to give breaths too, but at the very least, just giving Narcan can be very life-saving. So at least doing that can be really impactful. And then really quickly for fentanyl, like we mentioned, it being just so in the drug supply and really potent and really harmful. This is a huge reason there's a lot of overdose-related deaths. We encourage people to use fentanyl test strips for everything outside of their opioids. So for cocaine and for pressed pills that they're getting on the street, to test those for fentanyl, because it's pretty much in all of the opioids already on the street. And then xylazine, everyone should test their opioids for xylazine. This can cause really painful wounds and that are not easy to heal. This is to remind us that some things that we should do in approaching people who use substances. So definitely seeing if you're able to talk to your loved one while also respecting those limitations and respecting that it is the individual's choice, being as open as you can, showing as much compassion, trying not to have stigma or shame around it, and really understanding and treating it as a disease and a mental illness, and then being really sure to care for ourselves too, because it can be very stressful and draining. Some of this really depends on where your loved one is with whether they're open to talking about it, but trying to address things in a very empathetic way of identifying that there's been some things that you might be concerned about and asking how you can best support and how you can help. These are some really good resources, especially for communities. The OASAS and the SAMHSA websites have a lot of information for families and community. And SAMHSA, this site has videos and scenarios of family members interacting with their loved ones and how to approach those conversations. And then there's a Friends of Recovery New York guide too that I refer to a bit. So those are the QR codes. And then Never Use Alone is an important hotline. And I think when you approach people who are using substances and may not be ready to have deeper conversations on their substance use, being at least able to be like, do you have Narcan? And then also to call this hotline that will just stay on the phone with you as you use your substance to make sure that you don't overdose. And there's no association with any law enforcement or anything with this unless they are overdosing and they need help. And Smart Recovery is a really good resource, especially for alcohol use for both families and then also for people that maybe don't want to go to like AA, for example. They have a lot of resources for alcohol use. And then OnPoint is an overdose prevention center that's in Harlem and Washington Heights. So people can go there actually to inject their drugs in a very safe way and also get other resources. They have like acupuncture and they have physicians there to talk and feel like a safe space to use and then also talk about other things. And then I want to introduce Dr. Kala. She works at the REACH clinic. She's one of the primary care providers. So this is a REACH clinic.
My name's Betty Kolot. I'm a primary care doctor at the REACH program. We are a harm reduction oriented primary care program. So people can come to us for regular primary care, vaccines, cancer screening, smoking cessation, diabetes, high blood pressure, whatever their medical needs are. But we don't require that they are free of substance use. So people who are actively using drugs, people who used to use drugs or alcohol in the past, they can still come and get healthcare from us. And then we also can help people with reducing their substance use if that's one of their goals. And we have a psychiatrist and we give out sterile injection equipment and test strips and naloxone. So lots of different services. So if you have loved ones who are looking for a primary care doctor and are using drugs or have a history of drug use, you can send them to us. And we are on 102nd between 5th Avenue and Madison.
A lot of these services at the REACH program, there's a lot of coordination with peers and with people who have also been through things. And that's a real big push for people to be able to provide that resource of having more peer-led teaching and a community. So that's really integrated. And like an OnPoint, they do a lot of that. And a lot of these organizations, they'll do a lot of that. At REACH, they do a lot of groups.
You have to be surrounded by people who will help. I've always heard enabler as a role that's negative. So it was interesting to hear it as something not positive, but as a coping one. I always think of enabler as someone who's just kind of like assisting.
It is negative in some ways. And I think that coping mechanism was also to say that those aren't necessarily things that are helping the person who's using substances, but it's kind of ways that people are coping. A lot of that enabling for friends and family comes from a place of feeling like they want to help, but unfortunately there's limitations to that. And it can be more harmful to kind of be promoting what they're doing inadvertently even. So the main ways of trying to encourage people is to really being this like open-ended person to have conversations about things, but not to be like, oh, it's okay that you're doing this, or like to kind of validate it in a way that can be enabling.
It's a lifelong thing. There's triggers. It could be 20 years, 30 years. So it's just having compassion for people that are going through every day, one day at a time.